AURAVISION project is an animated recreation that aims to reflect how migraine patients view their auras. It is based on the testimony of real patients. Visual aura is produced by a transient depolarization of the occipital cerebral cortex, accompanied by a decrease in cerebral blood flow. The typical visual aura appears in 25% of patients, usually preceding or overlapping the headache. It can last between 5 and 60 minutes, with most patients explaining a duration of 20 to 30 minutes. It appears progressively, extending in the visual field, to disappear also progressively. Blurred vision. It consists of a blurred vision that can obscure the entire visual field and that appears and disappears progressively with a duration of between 5 and 60 minutes. Many medical conditions can also reproduce this phenomenon. Photopsias. These are probably the most common migraine visual aura. They consist of flickering lights, generally white or with little color, which appear progressively and can fill the visual field, preventing correct vision. However, the most common cause of photopsias is not migraine aura, but ocular pathologies. Spectral fortification. The vision of geometric patterns with irregular lines, zigzags, and angulations is typical of migraine. One of the most characteristic is spectral fortification, so called because it is reminiscent of the double-arched palisades of Turkish and Italian military fortifications. Growing scotoma. Also called C-shaped or bean-shaped. It is a generally grayish spot in the shape of a crescent moon, which expands progressively and disappears. Sparkling scotoma. This is probably the most specific aura of migraine and consists of the appearance of a spot, scotoma, generally grayish in tone, to which an incomplete, flickering, and faintly colored peripheral border is added in a few minutes. It spreads in an upper temporal direction of the visual field. Tunnel vision or water tunnel. This is the appearance of visual cloudiness in the periphery of the visual field with maintenance of normal central vision. It is like looking down the barrel of a shotgun or through a telescope, but instead of a black periphery, it looks like moving water. The filming took place in the Hospital de la Santa Creu i Sant Pau in Barcelona, the largest modernist complex in the world, declared a World Heritage Site by UNESCO.